Stop! This spinning object is a computed tomography scanner, otherwise known as a CT scan. A CT scan is one of the most powerful tools for getting X-rays of the human body. It continues to become a larger part of modern science due to its ability of producing clear 3D images of the body in just minutes.
Hey, fat man, I bet you couldn't even explain how a CT scan works.
Of course I can, Stewie. CT scan builds on the basic fundamentals of an X-ray, which is a type of electromagnetic radiation. It provides doctors with images of the inside of our bodies by shooting high-frequency X-rays called electromagnetic waves through our body to produce a 2D image. But what if we wanted to create 3D images instead? This is a CT scan's purpose. As we take a closer look at the tube-like machine, you'll notice the top has an X-ray generator and the bottom has an object called a detector array. People are placed in the middle as fan-shaped X-rays are emitted from the generator directly to the deflector while the entire thing spins around. This process captures hundreds of screenshots of your body from different angles. The role of that detector array is to measure how much of that X-ray has been blocked or absorbed by your body. This is otherwise known as attenuation.
You don't even know what attenuation means, Peter.
Actually, I do, Stewie. Attenuation is measured in the unit, Hounsfield units, and creates the color shades you see on CT scan images by determining the intensity of X-ray photons that penetrate the body's tissue. This is known as the attenuation coefficient. Materials that are dense or have a higher atomic number absorb more photons through the fundamental process called the photoelectric effect. In this example, cortical bone has the highest attenuation coefficient, absorbing more photons than low-density organs such as the lungs, which is why it appears white on the image. Each screenshot's attenuation data is converted into electrical signals and sent to the computer, where the process, filtered back projection, constructs a blurry image by overlapping the screenshots from multiple angles. To improve the resolution, a high-pass filter is applied to enhance high frequencies and reduce low frequencies. Finally, the 2D slices are layered through a process called volumetric rendering, creating a 3D image. Imagine it like combining slice of bread to create an entire loaf.
Good heavens. Who are you? What have you done with Peter?
It's still me, Stewie.
All right, smart guy. Tell me how CT scans are used in the medical field, then.
Of course, Stewie. CT scans are extremely valuable in the medical field because they detect irregularities in the body. They produce detailed images of bones, organs, blood vessels, and muscles, allowing specialists to accurately identify internal injuries or conditions. Because of this accuracy, specialists such as oncologists and neurologists rely on CT scans for diagnosing their patients and monitoring treatments. Oncologists, who specialize in cancer, use CT scans to identify tumors, determine tumor size and severity, and monitor how effectively treatments such as chemotherapy are working. The different attenuation coefficients of body tissue create a clear contrast resolution, meaning cancers can appear distinctly from surrounding tissue. As seen in this example of a lung cancer patient, the cancer can be easily separated from the lung's tissue. Another occupation? Neurologists who specialize in the brain and nervous system use CT scans instead of traditional X-rays due to their higher spatial resolution that can reveal small adaptations in the brain's tissue. CT scans are used to identify brain hemorrhages, tumors, and strokes. For instance, a CT scan is better than an X-ray because it can distinguish the difference between the two significant stroke types, an ischemic stroke or a hemorrhagic stroke. A ischemic stroke occurs when a blood clot blocks cerebral blood flow, whereas a hemorrhagic stroke is when internal bleeding occurs. X-rays cannot capture this difference, but it is critical for the patient's survival because it determines the correct treatment plan to follow. This use demonstrates how the development of science innovation has directly benefited the modern medical field.
It's almost like you're possessed, Peter. You can't even remember Meg's birthday. I'm interested now if you know about the benefits and limitations of a CT scan.
Well, Stewie, before I get into it, I want to mention that the benefits of a CT scan outweigh the limitations. The ongoing communication and collaboration of three highly technological fields, computer science, physics, and engineering, work together to produce accurate 3D internal images of the body. Computer scientists are responsible for the reconstruction algorithms that produce the images, physicists apply their knowledge of photon interactions and radiation safety, and finally, engineers construct and maintain the rotating gantry. CT scans have transformed the modern medical field. They actively save lives by detecting serious health conditions such as strokes or cancer at an early treatable stage. It is also able to assist surgeons when planning precise procedures or creating treatment plans for patients. This advancement of modern technology has directly improved patient survival rates and their quality of life. Its versatility also makes it incredibly valuable for the medical field, providing imaging for almost every part of the body, ranging from the brain to the abdomen. This allows for accurate diagnosis of countless medical conditions. Finally, CT scans are also highly efficient in producing results in minutes, reducing the patient's discomfort when compared to another imaging procedure, the MRI, which takes 15 to 60 minutes.
Wait, you said the benefits outweigh the limitations, but do you even know the limitations?
You would already know this, Stewie, but unlike an MRI, CT scans expose the patient to ionizing radiation due to the high-energy X-rays. Ionizing radiation can be harmful to the body over time because it removes electrons from the atoms in the body's tissue, which can cause cell or DNA damage, especially over continuous use. Mutations to the cells greatly increases the risk of radiation-induced illnesses, the main one being cancer. In an attempt to reduce these risks, medical physicists and engineers continue to refine and develop CT scan technology to minimize radiation exposure, increasing the safety of imaging. To conclude, this demonstrates how science is responsible for adapting and evolving to the response of ethical and societal concerns such as radiation exposure.
Wait a minute. Hey, Peter, would you like a glass of water?
Oh, that's all right, Stewie.
Peter, I insist. Here, take some! I knew it! I knew it was too good to be true. Rest in pieces, AI Peter.